Okay, ladies and gentlemen, I'm going to start a little bit early to moderate, and we'll be starting in 1 minute with a rapid fire session. And as you know, we will have very short communications, 2 minutes each. We are going to start with a Spanish abstract from Lorea Chaparro-González. Please come up and tell us about acquisition of molecular alterations in untreated low-risk MDS.
Good afternoon. I will briefly present our study in which we aim to evaluate the impact of acquired molecular alterations on the prognosis of untreated low-risk myelodysplastic syndromes. To do so, we performed target NGS in 147 untreated low-risk MDS using peripheral blood at diagnosis after at least 18 months and at time to progression, with a custom panel of 51 MDS-related genes. Our results show that patients who acquire alterations have a shorter overall survival, as you can see in the green lines, and a reduced time to progression. Interestingly, those patients who acquire alterations show different commutation patterns at diagnosis depending on whether they progress or not. In non-progressing patients, the most significant commutation was between SRSF2 with TET2, while in progressing patients was between ASLX1 with SRSF2, SF3B1 with TET2, TP53 with ASLX1, ETB6 with CBPA, and RUNX1 with MPL. In contrast, those patients who didn't acquire molecular alterations didn't have any co-occurring mutations at diagnosis. In conclusion, our results show that the acquisition of molecular alterations is associated with poor prognosis in untreated low-risk MDS, decreasing the overall survival and the time to progression. Only those patients who acquire alterations show different commutation patterns at diagnosis, being SRSF2 with TET2 the most significant commutation in non-progressing patients, and other 5 commutations were detected in progressing patients. Finally, to highlight, longitudinal molecular monitoring is recommended to predict these outcomes. Thank you.
Thanks very much, Lorea. And we continue the second abstract to be presented, Histone Deacetylase inhibitor Vorinostat, Tony Rached. Do we have the presentation?
Okay. So I want to thank the scientific committee for choosing our abstract. So in our past work, we have shown that in SF3B1 mutated variants, it alters MDS erythroblast transcriptome by reducing intron retention and by reducing the DNA-RNA hybrids or R loops at promoters and gene bodies. So it has been shown that the SYN3A THO complex that has a histone deacetylase activity in it will normally limit the R loop formation. So when we inhibit the histone deacetylases, we will restore the R loop. So in our study, we used the pan-HDAC inhibitor Vorinostat, and we did an immunoprecipitation of the R loops. And we observed that actually in the SF3B1 mutated samples, we have an increase of R loops and, interestingly, an increase of erythroid differentiation. So our aim was to explore transcriptional and epigenetic changes induced by Vorinostat. So first we did RNA sequencing, and we saw that differentially expressed genes between Vorinostat and vehicle allow an unsupervised clustering of the samples according to the treatment. And we observed also no overlap between genes with differential splicing events and differentially expressed genes, and an increase of the gene expression at genes that have gained R loops at the TTS, showing that transcriptome reprogramming is independent of splicing changes and depending on R loops. And then, thanks to our collaboration with MD Anderson Cancer Center, single-cell attack-seq were done on one SF SFTB1 mutated sample treated or not with Vorinostat, and then we saw an increase of the hallmark of heme metabolism in almost all the erythroid cluster, and the consensus motif of CALF1 with the Vorinostat treatment, suggesting that the Vorinostat will induce the erythroid-specific gene expression by increasing chromatin accessibility at CALF1 binding sites. So Vorinostat has the potential to reshape SF3B1 mutated erythroblast transcriptome through epigenetic changes. So if you are more interested in our result, please pass by poster 28.
Thanks very much. And now from France, we switch to China. Efficacy of hypoxia-inducible factor in transgenic mice. Fuhui Li.
The topic today is the efficiency of AMD70 in NOP98 HOXD30 transgenic mouse. AMD70 is a new kind of hypoxia-inducible factor PHD inhibitors, while the specific mechanism to improve anemia is unclear. In the study, we aim to evaluate the efficiency of AMD70 in an MDS mouse model, NOP98 HOXD30 transgenic mouse. NHD30 mice were randomly divided into two groups, which were orally dosed with 3 times per week with vehicle control or AMD17 respectively. After 2 weeks administration of AMD17 or vehicle controls, AMD70 group showed significantly higher hemoglobin, higher red blood cell count, larger mean corpuscular volume, and higher reticulocyte count than those in vehicle groups. The percentage of basophilic erythroblasts in bone marrow significantly decreased, while the percentage of also chromatic erythroblasts and reticulocytes significantly increased in AMD17 group after 2 week administration of the AMD70. As of now, after 5 months, AMD70 group hemoglobin significantly higher than the vehicle groups. In conclusion, AMD70 can significantly improve anemia in of NHD30 mice continuously and efficiently promote terminal erythroid differentiation in bone marrow of NHD30 mice, while the specific mechanism needs to be studied further. Thank you very much.
Let's continue the fire with a contribution from Brazil. First genomics study using 46 markers to stratify. Go ahead.
Good afternoon. It's a pleasure to present the results of your study. The first genomic analysis focused on the genetic ancestry in Brazilian patients with myelodysplastic neoplasm. And we explored how ancestry influences MDS development and progression in the genetically diverse Brazilian population. Using 6 ancestry-informative markers and techniques like multiplex PCR and capillary electrophoresis, we estimated ancestry proportions with structure software based on American, European, African, and Asian groups. Asian ancestry showed a predominantly European genetic compositions, followed by African, Amerindian, and Asian contributions. Asian ancestry showed a significant accumulation among MDS patients compared to controls. Individuals with a higher proportion of this ancestry showed increased risk of developing MDS. In contrast, a low proportion of this ancestry showed a reduced susceptibility to disease. Regarding European ancestry, there was association with a younger age at diagnosis, as well as a higher likelihood of classification in the low-risk groups according to the IPSSR score. This finding underscored the relevance of genetic ancestry influences in MDS and its potential role in personalized medicine of risk assessment and clinical decisions. Thank you.
Okay, thank you. Now we know that being Asian is better than being European in Brazil, and we switch to Svilena A from Bulgaria, and she will tell us about microRNAs in the plasma of MDS patients.
Good afternoon. I will present the results from our research, which aim to evaluate the diagnostic and predictive values of 5 selected plasma microRNAs, 22, 144, 16, LED7A, and 451A in patients with myelodysplastic syndrome and compare them to healthy controls. We also investigated their ability to predict MDS subtypes and for risk stratification. We included 40 patients with MDS and 10 healthy controls. MicroRNAs were isolated from plasma and quantified by real-time PCR, and their expression levels were normalized to a control microRNA. Furthermore, we stratified MDS patients by blast count and RIPSS. We found out that 4 microRNAs, 444, 16, LED7A, and 451A were significantly lower in MDS patients compared to healthy controls, and among them, 451A showed the most pronounced decrease. Using ROC analysis, we demonstrated the high diagnostic accuracy of these microRNAs, with the highest value for 451A with an AUC of 0.92 and high specificity and sensitivity. When we analyzed clinical subtypes, we found that both LED7A and 451A were significantly decreased in the low RIPSS risk group, whereas LED7A was lower in patients with low blast count. In conclusions, a significantly lower expression of 451A, 16, 144, and LED7A was observed in the plasma of MDS patients. And of these, 451A showed the highest diagnostic accuracy, whereas LED7A was associated with blast percentage and RIPSS risk. And based on our results, we can conclude that these microarrays could be possible non-invasive biomarkers, which supports further validation of these microRNAs in MDS. Thank you for your attention.
Okay, we switch back to Spain. Integrated cytogenetic and genomic profiling in an MDS cell line.
Good afternoon. So, among all the leukemia cell lines described, the MDS-L has been the only one established from a patient during the MDS phase of the disease. With the aim of providing a more detailed characterization of the MDS-L genomic landscape, we combined gold standard techniques of G-banding and multicolor FISH to define structural alterations, SNP microarrays and optical genome mapping to detect copy number variants and regions of homozygosity, and finally target NGS to detect driver mutations. 2 karyotypically distinct cell populations were identified, both showing a complex karyotype and found in the same proportion. The main difference between these 2 cell populations were the presence of a 1p arm gain or a derivative chromosome formed by the fusion of 1p and 7q arms. The combination of optical genome mapping and SNP microarrays allowed the detection of several aneuploidies together with 43 copy number variants, some of them occurring under karyotype resolution. A translocation between chromosomes 7 and 13 was identified, causing the disruption of retinoblastome 1 gene, and regions of homozygosity were detected in 5q and 17p chromosomes, among others. Targeted NGS detected 3 already described mutations in NRAS, TP53, and CBPA genes, and a new framesheet mutation in TET2. The integration of data from ROH and NGS allowed the detection of a multi-hit TP53 event. In summary, 72 alterations were detected, combining the results from all the techniques, and optical genome mapping was the technique that allowed the detection of a higher number of alterations, with 9 alterations exclusively detected by OGM. As conclusions, only 19 alterations were common across all the techniques, highlighting the efficiency of our multi-technique approach in samples with a high genomic complexity. TP53, retinoblastome 1 disruption, TET2 mutation, and TP53 multi-hit are here described for the first time in this cell line. And the MDS-L is a suitable resource for in vitro studies since it shows the main genetic changes of the MDS disease. Thank you.
last but not least, we go to Italy, and Luca Guarnera is going to tell us about the telomeres.
Good afternoon. Thank you for the introduction and for selecting our abstract. In our work, we measure telomere content with whole genome sequencing bioinformatic pipelines, namely telomere hunter and TIL-seq in a large population of melanoplasia patients, 1,800 patients, and we use a comparator 100 non-malignant clonal controls, including aplastic anemia and PNH, and roughly 50 non-malignant, non-clonal controls, including both healthy subject and polyclonal B lymphocytosis patients. First, we showed consistencies between the two bioinformatic pipelines, TIL-seq and telomere hunter, and then we decided to use telomere hunter for its capability of detecting the type of singletons, so the telomere elongation in the samples. Then we actually also confirmed the reliability of the technique with PCR-based methods, and then we dive into the correlations between type of abnormalities and obviously telomere content. Overall, we observed a general decrease of telomere content in MDS-AML when compared to the controls, whereas among the karyotypic abnormalities, we observed a higher telomere content in del5q and higher telomere content in balanced translocations, such as translocation 15, 17, A21, and inversion 16. Among mutational landscape, we observed higher telomere content in patients carrying ATV6, SF3B1, SRSF2, and TP53 mutations, and lower telomere content in those harboring FLT3, JAK2, KRAS, NPM1, and NRAS mutations, so hyperproliferative mutations. Furthermore, when comparing biallelic TP53 versus monoallelic and wild type, we observed a significant difference with an enrichment in telomere content in biallelic TP53. On top of that, in a model including karyotype, blast percentage, age, and diagnosis, TP53 was an independent predictor of higher telomere content. We also observed an enrichment in the canonical telomere repeats in TP53, which was also confirmed in statistical analysis, and also a correlation between TP53 mutation and the overexpression of genes in telomerase machinery, such as TERT, TERT, and DKC1. In conclusions, whole genome sequencing-based pipelines are reliable tools to measure telomere content. Overall, melanoplasia showed shorter telomere content, but TP53 had a telomere elongation. Overall, OGS-based pipelines could inform on the pathophysiology of shorter telomere content in melanoplasia and also identify patient subgroups eligible for imidazole treatments. Thank you.
And this concludes this rapid fire session. Thanks very much. And we continue shortly.